So, welcome, and you are all confused about what ideas to be written in task 2. You want to know the listening, what was the level, and you also want to know the reading passages, the names, of course, and what was in the task 1, right? So, this is a detailed video and it is a channel being run by an ex IELTS examiner. So, you can just expect genuine guidance. So, don't worry if you have given your IELTS, just check what you have written in task 2. And you can also ask me in the comments. And of course, if you have not given, then this is a boon for you, the video. Because all exam reviews I do in detail, it is not the waste of time. So I'll just read out, and it is hard work, children. If you want the final version of the part 1 speaking or the cue cards, the final version written by me, the real exam PDF written by me, you can contact me. Okay? So, without much ado, let me go to the question. I'll be reading it out, and of course, I'll be explaining. Don't worry. I'll tell you the idea. See, some people say that the government should pay for healthcare and education. Now, the key word here was health and education. You should not write about infrastructure of transport or roads. Some of you have written that. You have written a general view, expenditure of the government. No, the specific sectors, you are being out of the topic. Remember that. Then, whereas the others think that it is the government's responsibility. So it's not the responsibility of the individuals. It is only the government's responsibility. Understand the question. Okay, now discuss both views. You have to give both views, not one which you agree. This is what you are doing, and then your task response will go down, low band. Anyway, so first I will tell you two opinions about the government, supporting the government, and then why the government should not do it. Okay, first the government should do it. Okay, so like I am also telling you the topic specific vocabulary. I'll be repeating it. Okay, so just pay attention throughout the video and note down the topic vocabulary. Take out your notebook. Okay, it promotes quality. See, I have 37 years experience. I will not tell you something that is wrong. Okay, now you have to tell the reason. The government funded healthcare, funded, and education ensures that all citizens, regardless, see that, of their economic background, have access to essential services. So it is something that is inclusive. Okay, so for the public welfare, this is topic vocabulary, equality, equal access. Okay, now you could give, naturally you have to give an example. So in India we have the National Health Mission. In whichever part of the world, you can give your example also, that is not a problem. And the Sarv Sikhya Abhiyan in India, it aims to provide the health and the education for the underprivileged sections of the society, because we were doing for the quality. And these initiatives, note down the vocabulary, help bridge the gap between the rich and the poor, promoting social equality. So social equality, bridge. Okay, now long time economic growth, that is the key. So now how do I explain it? Investing in this, that is education and healthcare, don't write transport or something else, can lead to a healthier and educated workforce, which is crucial. Naturally, if the workforce is educated, healthy, there is economic development. For example, now the government, what it is doing, the midday meal, in India it is there. It improves the nutrition standards of the students there, and it also boosts the school attendance, because they can't afford to have one square a meal a day. and the social and the educational outcomes, they contribute to the force or people, those who are illiterate, and therefore there's development. Now, it is not the government's responsibility. You could write both, na? You could discuss any. So now, if we say it is not the government's responsibility, because there will be what? There will be financial burden on the government. So, how do you explain that? So, this funding, it can strain, put a strain on the government finances. Note the vocabulary. Just write it down. Leading to higher taxes. Naturally, you want something, the government wants something, so they get it through taxes, or reduced spending on other critical areas. Maybe they have to reduce on transport or something. So, like that. For example, in India, the implementation of the universal healthcare, that is the Ayushman Bharat, there's a program like that, and the critics, those who are critical of it, they argue that they have to divert their resources from like infrastructure developments, the roads and all that, those things. So there is like improving the public transport, reducing the traffic congestion, all those social things, or promoting some arts and all. So they have to divert. Okay. Then it encourages dependency. So the government is going to take care of our financial or our education or our health. So now, relying solely on the government provision can discourage private investment and innovation in healthcare. So the private parties would not, come. They will say, though it is not our responsibility. So private investment, innovation, and self-reliance. Now, private schools and hospitals in India often provide higher quality services compared to their public counterparts. Encouraging private sector involvement can foster competition. Naturally, there will be competition and innovation, leading to better services overall. And now I have given my balanced view. Okay, I have concluded in a balanced way so that you know how to conclude it, both sides. So I'll just read it out. In conclusion, see the complex structure, while the government involvement in healthcare or in health sector, you can say, and education or literacy is crucial or important for ensuring quality and long-term growth. So equality and long-term I have borrowed from the first paragraph. And it is also important to consider the financial implications, burden, second paragraph, and potential for dependency. So I told you dependency. A balanced approach where the government provides basic services while encouraging private sector participation could be more effective strategy. It could be better if there's a balance. This would ensure access to essential services for all citizens while promoting efficiency and innovation through private investment. Okay, now coming to the listening. They said the listening was easy, though I do not know, the students did not remember what was the topic and all that. And for the reading, they say some said it was moderate and some said first and the second was okay. So the first was, she said my student, that it was related to some choice that we made, and the second was related to some robots. It was about robots. Artificial intelligence is really becoming important. And the third was the significance of the mother tongue, related to mother tongue, right? And of course, the pie chart was not there for so many exams. So it was obviously that they are going to give you a pie chart where you had to compare the expenditures, and it was a pie chart and people could do it. It was not like the last exam where they were confused about the percentage and all. It was about future and all that, the bar chart. But this time they said that they could really do it well. So please like and share this. I do a lot of hard work, and one shared child can make a difference to anybody's life sometimes, and you be the one. Thank you, and God